Are you over 60 and worried about your health declining? You're not alone, but what if I told you that your best years could still be ahead of you? Recent studies show that many seniors are improving their health well into their 70s and 80s. In this video, we're breaking down the latest research on aging and sharing surprising health tips that doctors recommend for seniors. These aren't your typical eat your vegetables advice. Some might actually shock you. Did you know there's a simple daily habit that could dramatically boost your brain health? We'll reveal this and more. Curious to find out? But before I continue, please consider liking this video and subscribing to our channel. We appreciate your support. Now let's get back into the video. Have you ever noticed how some seniors seem to shrink as they age? It's not just your imagination. There's a silent threat affecting millions of older adults: bone density loss. Imagine your bones as a sturdy brick wall. Over time, without proper care, bricks start to crumble and disappear, weakening the entire structure. Let's start with a shocking statistic. Every 3 seconds, someone in the world suffers a bone break due to osteoporosis. That's not just a number, it's a life-changing event. About 43.3 million adults in the US are affected by low bone density or osteopenia. The scary part? It typically doesn't cause any physical symptoms. It's like a silent thief, slowly robbing you of your bone strength. Why should you care about bone density? It's crucial for your overall health and quality of life. As we age, especially after 50, our bones naturally start to lose density. For some people, particularly women after menopause, this loss can be rapid and severe. Women can lose up to 20% of their bone density within just 5 to 7 years following menopause. Many people have misconceptions about bone health in seniors. They might think it's normal to become frail and brittle as they age, or that there's nothing they can do about it. But that's not true. Once you've broken a bone due to osteoporosis, your risk of sustaining another fracture doubles. It can significantly impact your mobility and quality of life. So, what can we do about it? The solution doctors recommend might surprise you with its simplicity. It all starts with a bone density test. The most common and reliable way to measure bone density is with a dual energy X-ray absorptiometry scan, or DXA scan for short. Don't worry, it's not as scary as it sounds. This test is like getting a report card for your bones, giving you a clear picture of where you stand. When should you get this test? According to the Bone Health and Osteoporosis Foundation, women age 65 and older, and men age 70 and older should have a bone mineral density test. But if you have risk factors for osteoporosis, you might need to get tested earlier. Getting a bone density scan is a proactive step towards protecting your health. It's like having a crystal ball that can help you predict and prevent future problems. With this information, you and your doctor can develop a plan to keep your bones strong and healthy, potentially avoiding fractures and maintaining your independence for years to come. Have you ever heard of RSV? It's a virus that affects 1 in 3 older adults, yet most people don't know about it. RSV, or respiratory syncytial virus, can be a real troublemaker for seniors. It often gets mistaken for a cold or flu, making it tricky to spot. So what does this virus look like in older adults? It's not always easy to identify. You might experience a runny nose, fever, or persistent cough. Some seniors notice increased sneezing, loss of appetite, or unusual wheezing. What's more, these symptoms can appear differently in older folks compared to younger people, and they might not all show up at once. Here's where things get serious. RSV isn't just a minor inconvenience for older adults, it can be a real health hazard. It spreads quickly in crowded places like nursing homes or assisted living facilities. For seniors, catching this virus can lead to serious complications. The stats are eye-opening. Many older adults who catch end up needing hospitalization. If you're over 60, your chances of ending up in the hospital with RSV are much higher than younger adults. Why? As we age, our immune system weakens, making us more vulnerable. And if you have existing health issues like heart or lung problems, this can make them worse. RSV can lead to more serious issues like pneumonia or even respiratory failure. It's not just about getting sick, it can have long-lasting effects on your overall health. It's like adding fuel to a fire, and not the cozy kind you roast marshmallows over. But don't fret, there's good news. In May 2023, the FDA approved a vaccine for RSV. This vaccine works by introducing a form of the virus to your immune system, helping your body recognize and fight off the illness if you're exposed to it later. It's like giving your immune system a practice run before the real game. The vaccine is recommended for adults aged 60 and older, especially if you're at higher risk for severe disease. And if you're 75 or older, the CDC strongly advises getting this vaccine. It's a powerful tool to protect yourself against this sneaky virus. Remember, knowledge is power when it comes to your health. Now that you know about RSV and its potential risks, you can take steps to protect yourself. Talk to your doctor about whether the RSV vaccine is right for you. Stay informed, stay healthy, and don't let it catch you off guard. Did you know that nearly 40% of seniors take 5 or more medications every day? It's a staggering statistic that highlights a growing concern in healthcare. Polypharmacy. This fancy term simply means taking multiple medications, but its effects can be far from simple, especially when it comes to fall risk. Imagine an active 75-year-old who suddenly feels dizzy and unsteady on their feet. This scenario isn't unique. Many seniors find themselves in similar situations, not realizing that their medicine cabinet might be working against them. Research shows a surprising link between the number of medications you take and your risk of falling. If you're taking 4 or more medications, your fall risk increases significantly. But if you're on 7 or more, that's when things get really dicey. Dr. Jason Hill, an expert in this field, puts it bluntly. The probably single most high correlative cause is medications. He's particularly concerned about adults over 70 who are on certain types of drugs. So, which medications are the culprits? There's actually a list called the Beers List. This list includes medications known to increase fall risk in older adults. One medication that stands out is gabapentin, associated with the highest risk of falls. But why does this happen? As we age, our bodies don't process medications the same way they used to. Our kidneys and liver slow down, meaning drugs can hang around in our system longer. This extended stay can lead to side effects like dizziness or balance problems, increasing fall risk. On the bright side, there's a solution that doctors are getting excited about. It's called deprescribing, and it's all about finding the perfect balance of medications for your unique needs. Dr. Hill explains, we actually go in and talk to patients and say, can I reduce the dose or stop this medicine? It's like spring cleaning for your medicine cabinet. Remember, falls aren't just a minor inconvenience for seniors. They can have serious consequences, potentially leading to decreased mobility, increased dependency, and even a higher risk of mortality. In fact, falls are one of the leading causes of injury-related deaths in older adults. So what can you do? Start by having a conversation with your doctor. Regular medication reviews are essential, especially as you age and your health status changes. Your doctor can help identify any unnecessary medications and adjust your regimen to reduce your fall risk. It's all about finding the right balance to keep you healthy and on your feet. What if there was a simple, free activity that could add years to your life? I've discovered a 15-minute habit that's transforming seniors' health across the country. After weeks of research and expert interviews, I'm excited to share this life-changing secret with you. Let's start with a surprising fact. Walking is one of the most powerful tools for improving senior health. It's not just exercise, it's a full-body rejuvenation program. Picture this, you're taking a leisurely stroll around your neighborhood, enjoying the fresh air and sunshine. Little do you know, with each step you're strengthening your heart, improving your balance, and boosting your mood. It's like a magic pill without side effects. Walking is fantastic for your cardiovascular system. It helps maintain healthy blood pressure, improves circulation, and lowers cholesterol and blood sugar levels. For seniors, this is crucial. It's like giving your heart a gentle workout every day, keeping it strong and resilient. The benefits don't stop there. Regular walkers tend to live longer. Studies show that seniors who make walking part of their daily routine have a lower risk of chronic diseases and enjoy more years of healthy, active living. Imagine keeping up with your grandkids well into your 80s and 90s. That's the power of walking. Worried about falls? Walking can significantly improve your balance and coordination. It's like a natural fall prevention program. With each step, you're strengthening the muscles that keep you steady and improving your body's ability to catch itself if you stumble. Your mind benefits too. Walking has been shown to reduce feelings of depression and anxiety, improve cognitive function, and enhance overall mental well-being. It's like a natural antidepressant, no prescription required. Now you're probably wondering how much walking you need. The good news is you don't need to run marathons. Experts recommend 150 minutes of moderate intensity walking per week for seniors. That's just 15 minutes twice a day. Here are some easy ways to incorporate 15-minute walks into your routine. 1. Take a morning stroll around the block after breakfast. 2. Walk to the mailbox and back, taking the scenic route. 3. Enjoy an evening walk with a partner or friend. 4. Do a few laps inside a local mall or community center. Remember, you're not just improving your health, you're getting out in the world, meeting neighbors, and enjoying life. Walking also helps maintain a healthy weight and improves muscle strength and flexibility. It's a full-body tune-up, and all you need is a comfortable pair of shoes. So why not start today? Take that first 15-minute walk and begin your journey to better health. Your future self will thank you. Have you ever felt like your social life isn't what it used to be? Well, you're not alone. In fact, there's a hidden health crisis affecting seniors across the nation, and it's not what you might think. Let's dive into a condition that's often dismissed as just part of getting older, but could actually be cutting years off your life. Here's something that might surprise you. 1 in 3 adults over 50 reported feeling socially isolated in the past year. That's right, even after the height of the pandemic, loneliness is still a major issue for many seniors. But here's the kicker, this isn't just about feeling a bit down or missing out on social events. The U.S. Surgeon General has sounded the alarm, warning that untreated loneliness can lead to serious long-term health consequences. Maybe you're thinking, what's the big deal? Isn't it normal to slow down a bit as we age? Well, that's exactly the kind of thinking that's letting this silent epidemic slip under the radar. Many people mistake loneliness for a normal part of aging, but it's actually a significant health risk that demands our attention. Let's break it down. Social isolation isn't just about feeling lonely, it's an objective measure of how connected you are to your family, friends, and community. And loneliness? That's the subjective feeling that you're lacking meaningful social relationships. Both of these issues hit older adults particularly hard, especially during the COVID-19 pandemic. Think about it. During the pandemic, many seniors were taken out of circulation due to the high risk of infection. This sudden drop in social interaction left many feeling cut off and isolated. And even though things have improved since then, with isolation rates dropping from 56% in June 2020 to 34% in January 2023, that's still a significant number of seniors struggling with loneliness. But here's where it gets really serious. Research has shown a direct link between loneliness and higher death rates among older adults. That's right. Feeling socially isolated doesn't just affect your mood, it can actually shorten your life. It's like a domino effect. Loneliness can lead to cardiovascular disease, weakened immunity, and a host of other health issues. So, what can we do about it? Well, the good news is that increasing your social connections can have a dramatic impact on your health. Studies have shown that socially engaged seniors enjoy stronger immunity, decreased risk of heart disease, and even increased longevity. It's like a fountain of youth, and all it takes is reaching out and connecting with others. Easier said than done, right? It's alright, I've got some practical tips from the experts that can help you boost your social life and improve your health. First off, try to maintain your current connections. Give your old friends a call or reach out to family members you haven't spoken to in a while. In this digital age, there are plenty of online social activities you can engage in too. Volunteering is another great way to meet people and feel more connected. Not only will you be helping others, but you'll also be expanding your social circle. And if you're an animal lover, consider getting a pet. Caring for a furry friend can provide companionship and a sense of purpose. Here's another tip. Establish a daily social routine. Maybe it's a morning coffee with a neighbor or a weekly video call with your grandkids. Having regular social interactions to look forward to can make a world of difference. And remember, if you're really struggling with feelings of loneliness or isolation, don't hesitate to talk to your healthcare provider. They can offer support and resources to help you overcome these challenges. Ready to discover a surprising way to melt away stress? Contrary to popular belief, the secret for seniors isn't about doing less, it's about doing more. Welcome to the world of active relaxation, a game-changing approach that's got doctors talking and is turning traditional stress relief methods on their head. So, what exactly is active relaxation? It's all about engaging in activities that involve movement to release stress and tension. When you move your body mindfully, you trigger a cascade of physiological responses that help calm your mind and body. It's like hitting the reset button on your stress levels. Think yoga is the only way to practice active relaxation? Think again. While yoga is fantastic, there are tons of other options. Gardening, cooking, dancing, or even spending quality time with loved ones can all count as active relaxation. The key is to focus on slow, deliberate movements and controlled breathing. But the benefits don't stop at stress relief. Active relaxation is like a Swiss Army knife for senior health. It can work wonders for your heart, helping maintain healthy blood pressure, control your heart rate, and even lower cholesterol and sugar levels. It's also great for maintaining strength and flexibility, keeping you feeling young and spry. And let's not forget about your brain. Active relaxation increases oxygen and nutrient flow to your noggin, boosting cognitive performance and mental clarity. It's like giving your brain a refreshing spa day. One of the most exciting things about active relaxation is how it can speed up recovery from both physical and mental stress. If you've been dealing with muscle pain or tiredness, this could be your new best friend. It's particularly effective for addressing these common issues that many seniors face. Ready to give it a try? The good news is that even low-intensity activities can yield significant health benefits. Start small. Maybe with a few minutes of gentle stretching or a short walk around the block, you'll be amazed at how quickly you start feeling the benefits. Remember, it's not about becoming a yoga master overnight. It's about finding enjoyable activities that get you moving and help you unwind, so why not give active relaxation a shot? Your body and mind will thank you. Do you want to know how many seniors actually succeed in improving their health? You're not alone in your curiosity. Exciting research shows that a staggering 85% of seniors who consistently applied new health habits experienced notable improvements in their overall well-being within just 2 months. That's right. In as little as 60 days, you could be feeling better than you have in years. Let's explore a practical roadmap to revolutionize your golden years. Remember, success comes from starting small and building gradually. Choose 1 or 2 tips that really speak to you. Maybe it's a daily walk or trying some relaxation techniques. Pick something you can realistically commit to. Here's where things get interesting. Once you mastered your first habit, it's time to add another. This technique, called habit stacking, works wonders. For instance, start with a 10-minute walk after breakfast. When that becomes routine, add a quick stretching session before bed. Before you know it, you've built a powerful health routine without feeling overwhelmed. But what about those common roadblocks? Not a problem. There are simple ways to overcome them. For physical limitations, try chair exercises or water aerobics. These gentle activities can boost strength and flexibility without straining your body. If medication side effects are holding you back, talk to your doctor about deprescribing, a process that simplifies medication regimens to reduce side effects and improve overall health. Feeling unmotivated? That's where social engagement shines. Join a local seniors fitness class or walking group for support and accountability. It's a great way to make friends and fight loneliness too. Here's a quick checklist to get you started. 1. Choose one small achievable health habit to start with. 2. Practice your new habit consistently for at least 21 days. 3. Add another habit once the first becomes routine. 4. Join a social group for motivation and support. 5. Talk to your doctor about optimizing your medications. Imagine waking up each morning feeling rejuvenated, like you've turned back the clock. That's the power of these doctor-recommended tips. Picture yourself gardening with ease, taking daily walks, and feeling more vibrant than you have in years. It's never too late to take control of your health. Which tip will you try first? Small steps can lead to big changes. Share your health journey in the comments. Your story could inspire others. But don't forget to subscribe for more senior health tips. As the saying goes, your health is your wealth. Thanks for watching and subscribing to our channel. And remember, the best of your healthy golden years are ahead of you. See you in the next video.